Welcome to Lifesavers to the Rescue's nursing students navigating the NCLEX. We wrote this workbook to guide and assist you as you prepare for the NCLEX Next-Generation. One of the biggest issues nursing students, now graduates, have with preparing for the NCLEX is having so much information and not knowing how to prioritize and organize them. We know you're probably overwhelmed, trying to figure out where to start, what resources to use, and how to prioritize your time. Trust me, we know. We've been there. Therefore, our intentions are to simplify that for you, step by step. Our goal is to help you focus on what you do and do not know. We want to help you identify your weaknesses and correct them immediately. We also want to determine whether your weaknesses are knowledge-based or application-based. It will help you plan and narrow down what you need to study, how you need to approach it, and the times that works best for you. So take a deep breath, grab a pen, pencil, some Post-its, a notebook, and our workbook. Let's get started. Okay, let's begin. Here is how to use our workbook. We're going to begin on page 3, Studying Made Simple. It is simply the introduction of the workbook. Highlight or underline these words. Number 1. Select a study tool and resource. Number 2, shake off any anxiety or uneasiness. Number 3, complete your personalized AdPie. Let's start with number 1. Select a study tool and resources. Oftentimes, nursing students are overwhelmed with many resources and information. Unfortunately, it overshadows their ability to use them. We're going to fix that. Let's take an inventory of all of your current resources you collected during nursing school and most recently. This includes books, practice questions, courses, YouTube videos, flashcards, or whatever you have found very useful. Also, identify what has not been very useful. Remove them. Now let's filter them even more. Label each item under these 3 categories: lecture, bullet points, and practice questions. Lecture, bullet points, and practice questions. Lecture focuses on the big picture. Bullet points give specific details that are important to the big picture. Practice questions require you to apply the knowledge. Now you're going to place one item for each category: lecture, bullet points, and practice questions. One item. I provided suggestions that were beneficial to me. Our choices may be similar or completely different, and that's okay too. We want you to focus on what caters to you. For now, we will pause, revisit, and reapply them later in step 4, implementing, on page 193. Let's move on to number 2, shake off any anxiety or uneasiness. Complete pages 5 through 7. This section is called Before You Begin. We provided a checklist and a QR code to help you register for your exam. We also included an internal review to mentally prepare you. You will refer to them whenever you feel anxious and or overwhelmed. Complete your personalized AdPie, step by step. Place a tab or Post-it notes to the following pages. Step 1, Assessment, page 8. Step 2, Diagnosis, page 163. Step 3, Planning, page 178. Step 4, Implementing, page 193. And Step 5, Evaluation, page 205. Now turn to page 8, Step 1, Assessment. You're going to assess what you do and do not know. You will also be getting familiar with the Big 8. The Big 8 are key things the NCLEX uses to analyze how well you can answer the questions and apply the information at hand. Remember, the NCLEX Next-Generation includes case studies, fill in the blanks, along with select all the apply. Focus on what is being asked and keep your answers simple. Now let's take a trip down memory lane. Do you remember the courses and exams you did fairly well on during nursing school? How about the ones that were very challenging and difficult? The ones you excelled on, you're going to put them aside for now. We're going to focus on the ones that were difficult for you, one system and one topic at a time. For example, my strength was maternity. However, psych, neurological, and cardiovascular disorders and interventions were not my strengths. Therefore, I had to prioritize them when I began to study for the NCLEX. I did so by focusing on one weakness at a time. My intentions behind creating this workbook were to prioritize and focus on your weaknesses, one system and one topic at a time. As you scan through assessment, you will notice that each system begins with knowledge-based and each disorder within the system is application-based. Focus on the question or statement and keep your answers simple. Focus on one system and one topic at a time. Step 2 is diagnosis, page 163. Identify your strengths, but primarily your weaknesses. Refer to Step 1 assessment to identify them. Write them down by the diagnosis provided. Focus on one or two weaknesses at a time. As you're becoming more aware of those weaknesses, be specific on what you find challenging. The following pages will help you articulate them more thoroughly. For example, impaired knowledge of the cardiovascular system and the pathophysiology associated with those disorders and the appropriate interventions. Step 3, planning, page 178. Take an inventory on what is going on in your life. Work hours, appointments, birthdays, responsibilities, exam days, etc. Be honest, realistic, and specific. This section includes suggested study time frames, an example of a study schedule and calendar, 3 empty calendars, and the goals for the week. When planning your calendar, refer to Step 2 diagnosis to specify what you will focus for the week. Refer to the example provided in the calendar for more details, and use a pencil to write them down too. Step 4, implementing, page 193. By now you have already selected one item for each of these 3 categories: lecture, bullet points, and practice questions. Lecture focuses on the big picture. Bullet points gives specific details that are important to the big picture, and practice questions applies the knowledge in different scenarios and questions. Lecture. When focusing on the big picture, here are some of the questions you should ask yourself. For example, the cardiovascular system and disorders. If you had to explain the entire cardiovascular system, would you be able to explain it? Where would you begin? What are the organs involved? What do they do? Why are they important? How do they function with other parts of the body? What are the normal assessments and lab values? The same thought process applies to bullet points. You want to focus on specific details that are important to the big picture. For example, how do you know something went wrong within the cardiovascular system? What may have caused it? How do you know? What is the pathophysiology of this disease process? Is it usual or unusual for this scenario or population? What are the subjective and objective information do you have available to you right now? Is the information at hand sufficient? What are the safe and appropriate diagnostic tests and labs? Can you explain the appropriate interventions? Any pharmacological interventions? Side effects? Adverse effects? Can you differentiate between what intervention is appropriate and not appropriate? How do you know that it is effective? How do they affect other organs in the body? Are there any repeated labs and diagnostic tests? What should you anticipate? What should you not anticipate? Practice questions requires you to apply the knowledge in different forms. They may be select all the apply, fill in the blanks, or case studies. Remember, the exam is not knowledge-based. It is application-based. It is not what you know, but it is how you apply the information. Take your time reading and understanding the questions and answers. What are they asking you to do? What are the key words that are heavily emphasized? Is it a safety issue? A matter of appropriateness and scope of practice? What is the priority in this situation? Is it urgent, emergent, or critical? Do we need to think ABCs, airway, breathing, and circulation? Or more critically, CAB, compression, breathing, and airway? What will provide the best outcome with the information at hand? And why? If you can visualize it, then it is easier to explain it. Turn back to Step 3 Planning, page 178, and write your selected resources, system, and topic into your calendar. Detailed examples are provided. Step 5 Evaluation. This section will ask you if you have mastered your weaknesses. It is simply a self-reflection on your progress, requiring patience, grace, and honesty. If you do not understand the question at hand, let alone explain your answer, then you need additional time to correct it. And that's okay. Once done, focus on the next system and topic until you are comfortable and confident in your ability to take the exam. One more thing, page 212 before exam day. It includes recommendations before your big day. You always want to be prepared for anything. Again, one of the benefits of using our workbook is that you can monitor your progress. Stay focused and encouraged. The letters RN awaits you. If you are interested in critical care in the ICU, check out our next book, Nurses Navigating the ICU, on our website, lifesaverstotherescue.com. You can find our books on Amazon and Lulu.